Labor positions are something that we commonly use here at Lee Health Women's Services. Your nurse is here to assist you in deciding which positions are going to be best for you and your baby. We can do these positions whether you are going natural and unmedicated, or you have medication on board or an epidural. We're going to show you some of the common ones that we use here. They're both safe for you and your baby, and hopefully they'll help you progress with your labor, whether it's dilation that has ceased or we need to start getting the baby further into that pelvis. We hope that you enjoy watching this and just know what to expect when you're here with us. One of the most common positions that we use here at the Family Birth Suites is our birthing ball. It's basically a big exercise ball. You will have your nurse or support person position your mom on the ball. Be sure to be close to the bedside. The nurse will assist you on how to position yourself on the ball and during contractions. You will rock gently side to side. Some like to bounce up and down. And this is just to help some of the pressure relief and the baby to descend into that pelvis. One of our other popular positions is our squatting bar that we use. This is a bar placed on our labor bed. We use a sheet draped over the middle. The nurse will talk you through how to achieve this position. And mom, again, will be supported by her nurse or support person. You never want to leave her alone. And just have her swinging and squatting, again, to open that pelvic area and help the baby to descend into the birth canal. Another common position that we will use here on our labor unit is called knee chest. This position is used for various reasons. It's one of the most popular ones for the nurses to put our patients in, whether or not they have an epidural or they're going all natural. The reason for this is it's one of the most comfortable positions for the baby. If we are noticing on the monitor any signs of fetal distress or the heart rate lowering, we may ask the mom to turn over onto her hands and knees. The nurse will lower the bed and position the pillows, having her lean forward, and this creates a very comfortable position for both mom and baby. She can rock her hips side to side. If there's any cord compression issues or the baby is maybe facing what we call sunny side up in an OP position, this can help the baby turn. Or if the baby is coming down in an asynclitic, where they're coming down a little bit not direct in an angled position, this can also help move them back into the proper position to help descend into the pelvis. Another common technique we will use after we place a patient in the knee chest position is what's called the rebozo. This is typically a blanket that is placed over the hips. The nurse will grab both sides gently and begin to gently shake mom's hips from side to side. This is what's known as shaking the apple tree and one of our spinning baby positions. This will help baby if baby is in what we call an OP or sunny side up position to rotate and to also descend into the pelvis to hopefully come down in station. It's very comfortable for mom and takes the pressure off her hips and her back. Another common position that we will use after a epidural placement is the peanut ball. The nurse is going to assist the patient to lie back. And then she'll turn onto her side and place the peanut ball in between mom's legs. Again, this is used to help open up the pelvis, to help that baby descend, and hopefully lead to further dilation. It helps take the pressure off of mom's hips, keeping her pelvis open. And we'll typically switch the patient every 20 minutes or so and do the other side as well. Another common position that your nurse may put you in is something that we use often when moms have an arrest of dilation, where they stop dilating or the baby is still high in the pelvis and hasn't descended. This is what's called a side lying release position. The nurse will first lower you in the bed and then gently roll you onto your side. This position is often a position where mom can feel like she is going to fall off the bed. Rest assured, the nurse will be with you the entire time and you are safe. Mom's leg will just gently be draped over the edge. The nurse will remain with the patient and hold her in place. And again, this is just to help open that pelvis and hopefully further her dilation and the baby's descent into the pelvis.